Welcome to SheTV.com, where board-certified physicians talk to you about women's health. In this video, Dr. Anu Bajaj, a board-certified plastic surgeon, shares important facts about breast augmentation surgery. She is interviewed by Dr. Pooja Singhal, a board-certified gastroenterologist.
Good morning. I'm so thrilled to be here with my friend and colleague, Dr. Anu Bajaj from Bajaj Plastic Surgery. We are especially lucky to have her because she is board certified plastic surgeon, and we are here today to talk about a very common health topic that affects our female populations. So welcome, Dr. Anu Bajaj. How are you?
Thank you for having me. I'm great. Thank you, Dr. Singhal.
Well, let's get into a very, very common topic that actually I've had a couple of my patients talk to me about or ask me. And so I'm very thrilled to actually ask an expert. So today we're going to talk about breast implants. So let's start by talking about what type of breast implants there are.
So there are two types of breast implants primarily. There's saline and silicone implants. And silicone implants first were developed in the 1960s by Doctors Cronin and Giroux in Houston. And they implanted the first silicone implant back at that time. So since then, obviously, over the past 50 years, they've evolved. And so fundamentally, in a general sense, we have saline and silicone implants. Both types of implants have a silicone outer shell, but saline implants are filled with salt water, and then silicone implants are filled with silicone gel. And then when we talk about the silicone gel, they're different types or cohesiveness of the silicone gel. A lot of people have heard about the gummy bear implants, and that's just another type of silicone implant.
So how do you make the decision of choosing what type of implant one should get?
In terms of whether we choose between a saline or a silicone implant?
Yes.
So but to choose between a saline and a silicone implant is primarily related to patient preference. Some patients will prefer a saline implant because they like the comfort of knowing that if that saline implant were to rupture, it's just salt water that gets absorbed by your body. The main downside of a saline implant is it's going to look and feel more like a water balloon, whereas a silicone implant looks and feels more natural. And that's why some women may choose some of the more highly cohesive types of silicone gel implants. So, historically, as I said, the silicone implants were first developed in the 60s, and they've had several times of controversy. For example, in the 90s, there was a huge expose by Connie Chung when they were temporarily taken off the market, and then they were reintroduced in 2007. And what's evolved, and what I tell all my patients is that technology with the silicone gel itself has improved. Back in 20, 30 years ago, the gel was more less cohesive. It was more liquidy and more the consistency of honey. So when it ruptured, that gel would get into your tissues. Today's silicone gel is much more cohesive. So if it were to rupture, or when it ruptures, it maintains its form. And so we have different degrees of cohesivity today. And so that's where the gummy bear comes in, because the gummy bear implants are the most cohesive types of silicone gel implants.
Oh, that's very good to know. That's very good to know. And what do you think about the safety of these implants? A very common question I get asked or comes across just in general conversation is, how safe are the implants?
So both saline and silicone implants are FDA approved. So they are safe for implantation. And the question about what the safety also then evolves into educating the patient regarding the risks of the implants. Lots of medical devices are made of silicone. So that's a very commonly used implantable material, if you will. And so I would say the implants are safe.
Okay. And what about can they cause cancer? Is there a risk of cancer?
So breast implants do not cause breast cancer. However, in about 2014, 2015, we learned of a very rare and unusual type of cancer called breast implant-associated anaplastic large cell lymphoma. And as we have learned over the past 5 to 7 years, we believe that this type of cancer is caused by a certain type of textured implant, which is no longer available on the market. It was taken off the market in 2019. Breast implant-associated anaplastic large cell lymphoma is a relatively rare cancer with just a little over 1,000 cases reported worldwide. And you have to remember, we have over 25 million women in the world with breast implants. So that shows you how unusual it is. And if it is caught early, it is very treatable. And the way it typically presents is if a woman has this specific type of textured implant, she may develop a large fluid collection around her breast implant or a mass somewhere between 8 to 10 years after having had the implant. And so we hypothesize that it's an inflammatory reaction to the texturing of that implant.
Thank you. That's great. And actually that leads us right into a very, very important topic, which is of breast cancer. And how do you do breast cancer screening, specifically mammograms, when you have breast implants? What is your recommendation?
So as I said, a breast implant does not cause breast cancer. And in fact, there's been some data to suggest that breast cancers are detected at an earlier stage in women who have breast implants. And it's hypothesized that that's because you have a hard surface against which to palpate the breast when you're doing your breast self-exams. So in terms of screening, you would proceed with your regular screening mammograms that are recommended, which start at age 40 unless you're high risk. And when you have a screening mammogram, they do take additional views to compress the breast implant so that they can visualize the breast tissue appropriately. If they don't take those additional views, which are called compression views, and if they don't take those views, then a small percentage, about 5 to 10% of the breast tissue is obscured. So that's why it's important when you go get your screening mammogram that you inform the mammographer that you have breast implants. And then he or she usually knows to go ahead and get the additional views.
Wonderful. That's actually very, very important and very well said. And what I'm hearing you say is one key point is breast implants do not cause breast cancer. And number two, if you have breast implants, it's very important to continue the breast cancer screening for preventive care and let the mammographer know that you have breast implants so additional views can be taken. Am I right?
Yes, that sums that up.
Wonderful, wonderful. And tell me a little bit about how long do breast implants last?
So breast implants were never intended to be lifetime devices. So that means if you have a breast implant, at some point in your life, you will have an additional procedure to remove and replace it. Now, the older generation of implants, the ones from the 80s, 90s, and even early 2000s, their rupture rates would increase significantly after the 10-year mark. And that's where the internet dogma came that you have to replace your implants every 10 years. The reality is I don't believe you have to fix what ain't broke. And the newer generation of implants have much lower rupture rates that I think that if you're doing appropriate screening and you're still happy with the way your breasts look and feel, you may not need to replace your implants for 20 or 30 years. The rupture rate is typically like just in your head, you may think about it as 1% per year for every year you have the implant. And the biggest reason that implants rupture is just age. The older they get, the higher the probability of rupture. That said, the newest FDA guidelines from 2019 are that if you do have a silicone breast implant, that you obtain a high-resolution ultrasound every 3 to 5 years to screen for silent rupture. And the advantage of a high-resolution ultrasound is it's a simple procedure, it's painless, and it doesn't cost a whole lot of money. And frankly, a lot of plastic surgeons have the ultrasound device in their offices so that they can perform the ultrasound if you came in. And so what I usually tell my patients is if they have any questions or concerns about their breast implants, to call the office, to come in. We can do a quick ultrasound in the office, and then if we feel concerned about anything, we can then send them to a breast center for a more detailed ultrasound, if you will.
That's fantastic. That's actually very convenient. I did not know about that new recommendation about every 3-year ultrasound. That's quite convenient. Well, that's fantastic, Dr. Bajaj. I definitely learned a lot from different types of breast implants available, the evolution and history of breast implants, just the very, very rare risks with a certain type of breast implant, to what are the breast cancer screening recommendations after you have implants. So this has been so educational. Is there anything else you would like our audience to know that we may not have covered in our topic regarding breast implants?
Well, I think it's important to reiterate that while breast implants are safe, they may not be for everyone. And so I don't think when we talk about breast surgery, I think it's important to understand there are multiple different options that we can do to improve the appearance of our breasts. And, breast implants work well for volume increases, but I think it's important to have a detailed discussion with your plastic surgeon about what your goals, what your expectations are, and then proceed from there to choose the right option for you.
Very well said. Very well said. Well, thank you so much for your time this morning. And I'm so thrilled that our women and all our colleagues will benefit so much for this educational talk. So thank you.
Thank you for having me.
If you would like to schedule an appointment with one of these physicians, here is their office contact information. Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health. Please check back often, as we will be constantly adding new content. If you have any questions or particular subjects you would like us to address, please email us at shetv.com.